Hello, my name is Dr. John Kowalczyk. I'm a NUCCA Chiropractor in Michigan. I have two offices, one in Midland, Michigan, and one in Pinconning. I practice a specific type of chiropractic called NUCCA, which uses the first bone at the top of the neck to balance the entire spine. NUCCA stands for the National Upper Cervical Chiropractic Association. NUCCA is a specific type of chiropractic that uses the first bone at the top of the neck to align the entire spine. And how it works is anyone that has any type of accident, injury, repetitive stress motion that causes the head and neck to go out of place, when that happens, when the head goes one way, the opposite hip will pull up in order to make you lean that way to get your head back in the middle. Now once your head's in the middle, you're leaning to this side, so the next thing that happens is this side of your body will twist forward. So now the entire spine is twisted and turned and out of place and can cause pain and irritation. What we do as NUCCA chiropractors is we use that first bone at the top of the neck to realign the head and neck. And if we can get it exactly in the middle, as soon as we do that, the hips level out, the shoulders will level out, everything will come back to the middle. This only works if we're very specific. So we have to get that first bone at the top of the neck aligned to within 3/4 of a degree, which is the thickness of your fingernail. And if we get it that close, everything falls right back into place. NUCCA uses the first bone at the top of the neck like a lever to align the entire spine. We look very specifically at how far out of place or how misaligned that first bone is. We measure down to 3/4 of a degree or the thickness of your fingernail, how far out of place things are. Because we look so closely, it takes very little force to do the adjustment, which means there's no forceful manipulations, just a very light pressure behind the ear at the top of the neck in order to get everything to align. There's a couple of reasons that I really like doing it this way. One is if I can use that little bit of pressure to align the spine, then your body doesn't resist me. It just allows everything to let go. If I try to use a lot of pressure, everything tightens up. It's hard to get everything to move. The other thing is because we align the entire spine all at once, the spine tends to stabilize very quickly, which means less adjustments. How do we know if you are misaligned or if you need a NUCCA chiropractic treatment, or can NUCCA help you? These are the main things we look for in NUCCA to know if you're misaligned and if you need to be adjusted. If the atlas, or the first bone at the top of the neck, goes out of alignment, the rest of the body will compensate to that. And the main things we look for are, first, one hip being lower than the other one shoulder being lower than the other one, and one leg pulling up short or making it look like you have a short leg. Your leg is not shorter, but what happens is the muscles pull to one side in order to pull your head back to the center, and we call that a contracted leg or short leg syndrome. So if you're looking at, am I misaligned? Do I need to go in and see a NUCCA chiropractor? You can check these things yourself. You can look in a mirror and see, is one of your shoulders lower than the other shoulder? Is one of your hips lower than the other hip? If you lay down and have someone look at your feet, is one leg pulled up or contracted? Is your head leaning to the side? If any of those things are happening, then those are the type of things that would tell me as a NUCCA chiropractor that I might be able to help you. This is a simulation that shows the misalignment of the upper cervical spine. Here we have the brain stem, atlas, or the first bone at the top of the neck, and the bones of the neck below that. What happens during the misalignment is this line shows us exactly straight from top to bottom. This black line is level, and that's where we want things to be. When it misaligns, as represented by the red lines, first, the head is leaning to the right. Atlas, or the first bone, has ridden up the side of the head to the right, and the bones of the neck underneath have gone with it and moved to this side. What that causes is irritation to the brain stem, or all the nerves trying to go to the body, or the nerves coming back from the body to the brain, which can cause many different types of problems. What we do as NUCCA chiropractors is we apply a force to this first bone in order to move it back to the center, to bring the head back straight, and to bring all the bones of the neck back where they're supposed to be. We can demonstrate that with this simulation. We can see the force going in, we see the head come back to the center, we see the first bone level out, which takes the pressure off of the brain stem. Now all the nerve impulses are working properly again. This is the tool used by NUCCA chiropractors. This is a surface EMG, or SEMG. What it does is it measures the electrical impulses coming out of the muscles. So it tells us what the nerves are telling the muscles to do. In this patient, a patient of mine that has an Arnold-Chiari formation, what we're looking at is anywhere there's red, that means the nerves are firing off more than they're supposed to. Here, the greens are normals. We want them to be green, and we want them to be even from one side to the other, or balanced from one side to the other. In this patient, what we see is there's red in the low back, there's red in the neck, meaning that there's irritation in the nerves coming out right out of the spinal cord. But also what we look at, not just where there's not irritation, but we look at balance, where if we switch just to look at balance, we see that in the low back, it's more on the right. In the neck, it's more on the left. And what this shows me is that there's compensation. In other videos we looked at, in a NUCCA misalignment, what we see is one leg pull up shorter, one shoulder pull down. And these muscle tension, or the extra nerve impulses going to those muscles, cause that to happen. So in this patient, the nerves are firing more on the right side, which is going to pull that right leg up short, make them lean that way, and bring that left hip down. The nerves are firing off, going more to the muscles on the left shoulder, which is going to pull the shoulders that way, which is the opposite of the hips, which makes the middle want to twist. As a NUCCA chiropractor, what we do, by aligning the top of the spine, getting the pressure off of all of these nerves, we get the nerves to calm down like this, which makes the shoulders level out, the hips level out, the middle of the spine to unwind. As a NUCCA chiropractor, we use very specific x-rays to show us the misalignment of the spine and of atlas, the first bone at the top of the neck. The three specific x-rays we use are one from the side of the neck. This is the head, the first bone at the top of the neck, and all the rest of the bones of the neck. One from the front, which this is harder to tell what we're looking at, but this is the head, the jaw, eyes are underneath there, bones of the neck here, shoulders down there. Specifically right here is the first bone that we're going to be looking at. And then the other one is from the top down, where this is the nose, the eyes, the back of the head. And this kind of oval shape right here is atlas, or the first bone looking straight down on top of it. These are x-rays of a specific patient I had that has a Arnold-Chiari formation at the top of the neck. What that means is there's a little part of the brain or brain stem that is coming down into the canal where the first bone sits, putting pressure, causing neurological deficits. So with this patient, what I want to look at with the x-rays is how we look at the misalignment and what we do to correct it. This is the x-ray that we took from the front that shows how the misalignment goes. There is a line that is straight up and down from the center of the shoulders, and that's where we want things to be. What we have with this patient is the neck is leaning off to the left by 5 3/4 degrees. The head is leaning
back towards the right by 1 degree. And then the first bone that sits in between the head and the neck is atlas, or the first bone, and that's the bone we use to move things back to the proper position. That bone has moved to the left and ridden up the side of the head by 1 degree. It only takes 3/4 of a degree to cause problems or neurological deficits, but when we add up the 1 degree and the 1 degree of head tilt and the 5 3/4 degrees of the neck leaning to the side, that causes the misalignment or the pressure on the brainstem that can cause problems. We do the adjustment, and in this patient I would have done the adjustment from the left to push things back to the center, and this is an x-ray we took after the adjustment to show that we got things back to where we wanted. And in this x-ray, the head is straight, first bone is level, neck is straight, and head is right on top of the shoulders, the way that it's supposed to be. This means no pressure on the brainstem, which means the nerves can function properly again, meaning the patient feels better. This is the x-ray that NUCCA practitioners take looking from the top down. And again, what we're looking at here is, this is the nose and the eyes, and this is the back of the head. And this oval shape is the first bone looking straight down on top of it. What we're looking for on this x-ray is rotation. In this patient, and this is the patient that has the Arnold-Chiari formation, we have atlas, or the first bone, is rotated backwards on the left by 5 1/2 degrees. After one adjustment on this patient, we retook the x-ray and we found that it had reduced to 3 1/2 degrees. We want to continue to get that to get smaller and smaller, but what this shows is after one adjustment we're able to reduce the pressure on the brainstem, meaning less neurological irritation, meaning the patient will feel better. This is the x-ray that we as NUCCA practitioners take from the side of the spine. So what this is showing is, these are the bones of the neck, this is the head, this is the first bone at the top of the neck that we use to try to move everything back to the center. What we're really looking at on this x-ray is, we want the neck to have a curve, to the forward curve. And the reason that's supposed to be there is that curve serves as a shock absorber. If there's a curve, then any force that goes into the head, that curve can absorb it. But when the neck starts to straighten out from the side, now any force that comes in, the neck can't absorb it, and it starts causing more pressure. And what we're looking to do as a NUCCA practitioner is reduce the irritation to the brainstem and to the nerves. This x-ray was before we did the adjustment on a patient we had with an Arnold-Chiari formation. And after the adjustment, this is an x-ray we took after the first adjustment. And while it's subtle, what this shows is the neck is starting to curve a little bit more. If we look at the backs of these bones right here, we can see that here the neck is very straight. If we look at the backs of these bones, you can see that they're starting to get a little bit of a curve in there, which is going to build more give into the system, which is going to make his body able to absorb the forces or function better in his environment. Here what we're going to look at are the measurements we do to decide if someone needs a NUCCA adjustment. What we're going to look at right now is to see if the shoulders are level. And we measure, and on her we see that her left shoulder is 2.75 degrees lower than the right shoulder. What we're doing now is we're doing measurements to see if someone needs a NUCCA adjustment. When things are out of alignment, the head will tilt to one side, and that causes the hips to want to lean to the other side, causing one leg to pull up shorter and one hip to drop down. So the measurement we are going to do is to decide if the hips are level. And in her, the left hip is 4.9 degrees lower than the right, indicating that she is not level and that she would need an adjustment. What we're looking at here is to see if she has a contracted leg, and what that means is one of the legs, if she's out of alignment, will look shorter than the other leg. Now the leg isn't shorter, the bones aren't shorter than the other side, but what happens is as the head goes one way, the muscles on the opposite hip will tighten up and pull that leg up shorter and make it look short. So if we look at her, she has, her left leg is about 1/4 of an inch shorter than the right, meaning that it is contracted and that she needs to be adjusted. This is a demonstration of the actual NUCCA adjustment. As we said, it is very light, it's very gentle. What we're doing is we're using the first bone at the top of the neck where it sticks out to the side, and with some very specific measurements we did off of some x-rays, we know the exact direction to put the force into this first bone, to use it kind of like a lever to get the entire spine to straighten out. So we did our measurements and we know that she needs to be adjusted. So now we are going to do the adjustment. We need to find this side of the... That's it. That's all it takes to do the adjustment, and it actually looks like more force than it is, but it's just a very, very light pressure to this first bone. And if I can get this first bone exactly where it's supposed to be, as soon as I'm done, the hip should level out, the shoulder should level out, and everything should go back where it's supposed to be. And I need to do it a bunch of times because I'm only moving things a little bit each time I do this. Each time I do it, it only moves about the thickness of your fingernail, or about 3/4 of a degree. Because it moves only a little bit at a time, it takes very little force. Now we are remeasuring the legs, looking for the contracted leg, which means before the adjustment, this leg was pulled up short because the muscles in the hip were tight, reacting to the head and neck being tilted to one side. We did the adjustment. Now we look at the legs, and the legs are exactly even, meaning that the muscles have now relaxed, the leg dropped back down level, which means she is in